Hey folks, it is Tuesday, February 9th, and it's vaccination day at Birch Hill, so that's exciting news. Super excited for Birch Hill today. Riverwoods Exeter had their first vaccination clinic last Wednesday, and by all accounts, that went really well. May have been the first thing that everyone agreed on in 26 years that it went great, so that's wonderful. And Riverwoods Durham has their vaccination clinic, their first clinic, on Friday. So all's going well in those accounts. Couldn't be more excited. You couldn't be more excited. I'm back in the office today. My back is better. I'm going to get you at least, half a day worth of work out of me today. So trying to get you your money's worth. But a few things, a few updates to focus on here. First clinic is great. First shots are great. We want to celebrate. We can. But remember the concept of masks and a small social circle, because your immunity builds up in your body. You won't reach the 95% immunity level until 14 days past your second shot. So that's going to be in March for all of you. So we just have to take it slow in terms of any adjustments in our life. A few things about adjustments here. Number one, the whole concept of wearing a mask, that's not going to be an adjustment that's not going to change for quite a while, not in the foreseeable future, because we're on the leading edge of vaccinations, and that is great for all of us, but the rest of the world has to catch up. So masks are still a thing, small social circles still a thing, washing your hands should always have been a thing, but still a thing. So don't anticipate any major changes in our operations until April 1st. We want to do a few things. Number one, the executive directors are working on reopening plans, which is it's cool just to say those words, but we're going to be slow and steady with that, because a few things. Almost all of us are vaccinated, and that's great, but the outside world is not. And so there are still risks, and it's not 100% immunity, and there are variants that are coming around in the world, so we still have to be smart, slow, steady progress. So we will follow guidance from the CDC and the state related to travel. Some of you have already asked about travel. No changes yet, and honestly, you can't anticipate any changes until, at a minimum, you're 14 days past your second shot. But related to our health centers, we will follow guidance from CMS, which is the Center for Medicaid and Medicare Services. We'll follow guidance from the Department of Public Health and the CDC. So that's going to relate to visitors. It's going to relate to spouses visiting, people coming in. It also, on the independent side, for those of you who want to travel, we're going to follow CDC guidance related to quarantines and travels. So we have to give the federal government and those agencies a little time to catch up and make their determinations on best advice, and then we will share that with you and implement it here. Good things are ahead. They're just not going to be like flipping a light switch. So what I would ask you to do is be happy, because it's kind of fun to be happy. Be excited, but also maintain we've done so many good things and smart things and safe things in the course of the last 48 weeks. And if we can hang in there a little while longer, things are going to gradually get better. So as we think about reopening, what I would ask you to do is think about that in terms of a gradual plan where we can adjust our operations in a safe way. We've been going without human interaction. We've been going without togetherness. We've been going without opportunities for time together for a long time. And we're going to have more of that, but in a very kind of slow and steady way to get back to whatever normal will look like in the future. So hang in there. By mid-March, you will get a reopening plan and some guidance from your executive director. It may not be exactly the same campus to campus, based on just the way things work out within the campuses, but generally very similar. And I guess what I want to end with is just hang in there. Like, we are so close. We've done so many smart things. You're still here. I'm still here. We're still here. That's all good. Let's stay smart until your immunity is there and the rest of the world has more of a chance to to catch up. The J&J vaccine should be coming in March. More people will get inoculated. We just have to hang in there a little longer. So until then, stay healthy, my friends.